Welcome to The Explainer. Today, we're diving into how a medical app gets made. But this isn't a story that starts with a bunch of coders in a room. No, this story starts with listening, really listening to the people the app is meant for. Let's get into it.
So, before we can even get to the solution, we really have to understand the problem. And for patients dealing with heart failure, the challenge is huge and it's not getting any easier.
Okay, let's zoom out for a second. Heart disease is, believe it or not, the #1 killer worldwide. We're talking almost 9 million deaths back in 2019 alone. And a big piece of that puzzle is heart failure, a chronic condition where patients have to be on top of their health 24/7. Now, here's where it gets really tricky. For so many of these patients, it's not just about their heart. They're often dealing with what's called multimorbidity. So they might have diabetes or lung disease or other chronic issues at the same time. Just try to imagine juggling the diets, the medications, and the exercise plans for 3 or 4 different conditions. It is a constant and honestly an overwhelming balancing act. So to handle all of this, you need more than just info dumped on you. You need a skill. It's called health literacy. And no, this isn't just about whether you can read the label on a medicine bottle. It's about being able to find the right information, actually understand what it means for you, figure out if you can trust it, and then, and this is the key part, actually use it to make good decisions for your own health.
Because here's the thing, when health literacy is low, the stakes are incredibly high. You see more mistakes with medication, people don't understand their own disease as well, and what happens? They end up in the hospital more often. This is the exact problem that a team of researchers in Spain wanted to solve.
An app, seems like a pretty obvious modern solution. But just building an app isn't the answer. I mean, there are thousands of health apps out there, but so many of them are built without ever talking to the people who are supposed to use them. If you want it to work, you have to build it the right way. So instead of just guessing, these researchers used this really smart 3-step process. They looked at the existing research, sure, but then they did the most important thing. They sat down and had deep conversations with patients and the people who care for them. And from those talks, they created what are called user stories, which are just simple ways of saying, as a patient, I want the app to do X so I can achieve Y. And this quote right here, it's a perfect example of the gold they got from those interviews. This isn't some abstract idea, it's super practical, real-world stuff. Patients wanted a tool that could help them right there in the grocery aisle, helping them decide what to put in their cart. You just don't get that kind of insight unless you actually listen. And when they looked at all these stories together, a super clear picture emerged. A whopping 90% of patients wanted a quick, easy way to get help in an emergency. Big numbers also wanted practical info on exercise and what to eat. And they also asked for warnings about dangerous food and drug combos, and, this is cool, they wanted motivational messages to keep them going. Okay, so now they've got this awesome blueprint, designed by patients. But listen, for a medical app, being user-friendly isn't enough. It has to be clinically sound, totally accurate, and, actually effective. And that's where the experts come in. To make sure all the content in the app was A+, the team used this really cool process called the Delphi method. Basically, you get a panel of experts, and they all review the content anonymously. They give their feedback, the team makes changes, and they do it again and again until everybody's pretty much on the same page. It's a fantastic way to refine ideas without anyone's ego getting in the way. The experts judged every single mock-up screen of the app on 2 simple but totally crucial ideas. First, relevance. Is this information absolutely essential for a patient? And second, adequacy. Is it presented in a way that's clear and easy to understand? Is it important? And is it clear? That's the whole ballgame.
And check this out. The expert panel wasn't just doctors and professors. Critically, it also included patients themselves. And that just hammers home the whole point of this project. Patients weren't just subjects being studied, they were active partners in building and approving this tool.
And you know what? The process worked beautifully. Out of 59 initial screens they designed, 57 of them passed the expert check with flying colors. The 2 that didn't, they were either changed based on feedback or just taken out completely. This made the final product so much stronger and more focused. So after this whole journey of listening, designing, testing, and refining, the final product was finally ready. Everyone, meet MyCardiapp. And you can see how those patient priorities we talked about earlier are baked right into the final features. You've got guides for getting active, tools for nutrition, medication management, all the stuff patients asked for. It even has resources for emotional support and a fun gamified section for learning, which hits on that need for motivation. It's a tool built to empower. But hold on,
The story isn't over yet. Building a fantastic app is one thing, but proving that it actually makes people's lives better, well, that's the final and most important step.
And that's exactly what's happening as we speak. The app is being put through its paces in a year-long randomized controlled trial. This is the gold standard for medical research. You have one group of patients use the app along with their normal care, and another group just gets the normal care.
This trial is designed to answer the biggest questions. Can this tool, built hand-in-hand with patients, actually improve their health literacy? Can it help them manage their own health better? Can it help them take their meds on time? And the big one, can it help keep them healthy and out of the hospital?
This whole process, really, from those first patient interviews all the way to this massive clinical trial, it shows a powerful shift in how we can think about healthcare technology. And it leaves us with a really important question. What would the future of medicine look like if every tool we made was built not just for patients, but with them?